All right, well, thanks everyone for coming out tonight to braving the weather for tonight's presentation on hospice. And we're pleased to have with us Evelyn Lewis from Patient Care Hospice. Evelyn, welcome and thanks for doing this.
Thank you. I appreciate you guys having me and again coming out in all this rain. It's definitely a little unexpected. So I'm Evelyn. I am the volunteer manager at Patient Care Hospice. We're a part of LHC Group, which is our overhead hospice. So if you ever hear that name, there's a bunch of little hospices a part of that group. I am fairly new to this position as of a couple months ago, but I have about 3 or 4 years of experience in hospice care. And volunteering is really my passion. So I'll talk to you a little bit about hospice. So we'll talk about what is hospice, the hospice benefit, everything you get when you come onto hospice, some myths that some people have about hospice, and kind of talk to you about the true parts of that, hospice volunteering, and then we'll have some questions and answers. So first, does anybody have experience with hospice? Anybody know a lot or not at all about hospice? Yeah?
My mother was on hospice.
Okay, yeah. A little bit of experience?
Oh, absolutely. They were wonderful.
Yeah.
Yes.
Glad hospice was able to help. Yeah.
My mom's on hospice right
Okay.
now.
Okay. Yeah. Unfortunately, a lot of people spend a very little amount of time on hospice, and that's one of the things we're trying to kind of spread education, that it's not just for those last couple of days. You can have it for as much as 6 months. We've had patients for a year. It's not quite as kind of that death's door that a lot of people think of it as. So what is hospice? We really say it's a philosophy of care. It's kind of the idea that death is natural, we're not hastening anything, we're not slowing anything down, we're just helping that person have a peaceful end. So the care is for the whole person, we care for the family as well as the patient. It promotes that everyone has the right to die with dignity. So we have a whole team of people that is dedicated to caring for both the patient and their family. We kind of see them as a unit of care. So we're looking after the caregiver as well as the patient, as well as anyone else that they identify as members of their family. Could be neighbors, friends, actual family. So it's a Medicare benefit. So Medicare has a benefit worked into it, which helps pay for hospice. A lot of what we do is funded by Medicare, and Medicare actually has a lot of regulations for how we do our work. One of those is volunteering. So it dictates that at least 5% of all the hours that we spend with patients have to be done by volunteers. So that is a major part of what I do, ensuring that we have volunteers in touch with patients. That could be in person, that could be on the phone, that could be mailings. All of those things count towards that percentage. So that's a big part of Medicare and hospice that I don't think a lot of people know a lot about. And an interdisciplinary approach to care. So interdisciplinary, it just means we have a lot of different professions that are all working together on the same goal. So we're all working towards that patient welfare, patient comfort. We all have the same goal, but we're all coming from a different place. We all have a little bit of different background for us. Oh, sorry. So this is the hospice team. This is that interdisciplinary team. So first and foremost, we have a attending physician. So everything is, still has that medical mindset. So we have a hospice medical director that works for our team. The patient can choose to have that medical director as their primary care physician, or they can bring in, their family doctor or the person that diagnosed them. Whoever they want to have as that primary person, that person that's going to be dictating the meds they get, all that kind of thing, they get that choice. We tend to recommend our doctor. He's a little more specialized in hospice care, just like you would go to an oncologist if you had cancer. So they know a little bit more about those comfort meds, really know about the side effects, kind of how things will work together. Some other doctors just don't have that expertise. We have registered nurses. So the nurses are the people that are really seeing our patients face to face. They go out and see our patients at a minimum once a week. Usually it's more like 2 to 3 times a week. So they order all of the medical equipment they need. Basically anything you can get in a hospital, you can get transported right into your home to help with that medical care. You can get a hospital bed, over the bed tables, wheelchairs, pretty much anything you can find in a hospital. They also help with ordering meds, getting people connected to other resources that they might need. The social workers are another huge part of that. They help with funeral planning, a lot of things that people necessarily don't really want to think about yet, but you do have to have that in place when you're thinking about that ending process. They also help within community resources. Say somebody wants Meals on Wheels and isn't sure how to get connected. The social worker is great with that. If somebody's living in their own home and is looking to get into a long-term care facility or wants to go to a nursing home, social workers will make all those phone calls, make sure that there's a bed available, and get you all set up to go right into that facility. Spiritual care coordinators, we call them chaplains. Our chaplains are non-denominational. They're able to cater to pretty much anybody, religious, spiritual, non-religious. Some of them have certain specialties that they'll work with, but are able to care for anybody. Any of those kind of what comes next questions. They're really the experts in that kind of thing. Bereavement counselors. Bereavement counselors help after the death. The family's struggling with that death, they're grieving. Our bereavement counselors follow up with those families for over a year after the patient has passed. They keep calling them, they do in-person meetings as well. We send mailings, kind of remembering their birthday and dates of death, things that might be kind of tough days for our clients. It's a good time to remind them that we're thinking of them and we're here. We're the ones that kind of cared for their patient or for their loved one, and we're still thinking of them. We also have some events and things to help remember those people. Around Christmas time, the holidays, we usually do some kind of tree of light, remembrance. This past spring, we did a butterfly release. Just a time to bring some people together that have all suffered a similar loss. Able to get to know people, but also work directly with our bereavement counselors. They are not therapists. They will refer out to therapists if there is kind of a more risk, someone that's really, really struggling. They'll definitely refer out to somebody else that's a little more specialized. Dietitians and pharmacists, just helping kind of those community resources that are helping with everything that our patients need. Ordering those meds, getting connected with food resources, so some of our community resources as well. Physical, occupational, and speech therapists, again, that's a community resource. Not everybody will have these resources, but speech therapists could kind of determine what level of food somebody could have, whether they're an aspiration risk is what we call it. So if they could choke on solid food, they're gonna have them on a pureed diet. So can give kind of insights to things that we might not 100% know about. Home health aides, they help with those activities of daily life. Someone's in bed and not able to get up and toilet themselves, not able to get up and shower. They come in pretty much every day and are able to help with all of those physical needs. If you're not at that point yet, you don't necessarily need someone to give you a bed bath. They'll sit with you for an hour, socialize, help you clean up your house. They pretty much do anything you can think of. Volunteers, that's my area of expertise. So volunteers are a huge part of the team as well. They're kind of the non-medical person on our team. They can talk to our patients about anything. They don't want to talk about what level of pain they're in, kind of those medical questions. They do some life review is really important. Thinking back on, what was the important parts of my life? What do I want to maybe pass on? Doing a legacy project, kind of passing something on to my children or grandchildren. Just having a conversation, maybe if they're in a nursing home and don't have many visitors. It's a great thing for a young person. I have a lot of high school volunteers right now. So a young person to come in and have a conversation with them, wheel them around the facility, take them outside. Just little things like those socialization, companionship makes a huge difference for people that are otherwise fairly isolated. And then any other healthcare professional needed to provide care. So we'll bring in extra people as needed. Not everyone will elect to have every single one of these people on their team, but these are options for every patient that we have on service. The only two that are required are a nurse and a social worker. So every patient has both of those people, and then all the extra people will come in as requested. So the hospice benefit, how does somebody come on to hospice? So in order to be admitted, you have to have a diagnosis of 6 months or less. And that's certified by usually their physician that has called hospice and said, hey, I think this person qualifies. And then our physician as well also sees them and certifies that, yes, I agree with your opinion. This person has 6 months or less to live. Now that doesn't necessarily mean if they outlive those 6 months, they're kicked off of hospice. So we'll talk about that next. And then also the choice to elect hospice. We're not gonna bring anyone on unless they want to have our hospice services. So that's a major part of it. So the benefit includes all of those members of the team that I just mentioned. So they get all of those people coming into their house or not, completely up to their choices. They get all their medications, supplies, and equipment, as long as it's related to their life-ending illness. So if somebody has diabetes and is taking diabetes meds, we might not necessarily pay for those, but we would pay for any pain meds, anything that's managing their actual disease. Spiritual and emotional support, as I discussed, and then bereavement support for the family for up to 13 months after the patient has passed. So we go a year and then an extra month, just to make sure everyone's coping okay. So we does not include treatments intended to cure. Like I said, we're not hastening things, we're not slowing anything down, we're just letting the disease run its course. So if someone decides, actually I do think I want to go and get a treatment, we would discharge them from hospice, allow them to go do that. Once they decide, actually no, I think I'm done now, they can come right back onto service. Like I said, anything not directly related to the hospice diagnosis, and then routine room and board in a skilled nursing facility. Unfortunately, nursing facilities are expensive. That's just a part of kind of dealing in long-term care. So we don't pay for that, but we will go in and offer kind of jointed care. So whatever care they're getting in the facility, we'll still come in and offer those same services right alongside them. Certification. So any patient who continues to qualify will remain on hospice even past their initial 6-month diagnosis. So the way that works, somebody comes onto service, we certify them, say yes, they're eligible for hospice, they're on with us for 60 days, sorry, 90 days, 60 days, 60 days. After those 60 days, we go see them again. We make sure they're still declining, they still have that life-limiting illness, they're on for another 90 days. And then we see them every 90 days just to say, yes, they're still on our service, they still qualify. What happens is with the great care that we offer, sometimes people get better. They don't have to go to the hospital every couple of days. They're having care right in their home. Their caregivers may be a little less stressed. Some people do start to kind of stabilize, even improve a little bit. So we call that graduating from hospice if we have to discharge somebody because they just don't need our care right now. We discharge them, kind of let them do their thing for a little bit, and then we'll bring them right back on once they've kind of progressed a little bit more. So there's always that choice. You can, choose to come off hospice yourself. We'll always have that discussion with you of this is why you maybe don't qualify anymore, but you can always come back onto our service. So yeah, like I said, patient and family may choose to revoke from hospice at any time, or if they improve and their prognosis is no longer 6 months or less. So some myths. So this is what I already talked about. Hospice care is only for the last days or weeks of life. But with early hospice care, somebody could come on, like I said, as long as they have that 6-month diagnosis. So we've had patients for over a year, had a patient for 2.5 years. So that's not necessarily the norm, but that is an option. We've also had patients for a couple of hours. Somebody that comes on admitted from the hospital and just needs that care right then and there. So some can improve and even be discharged from hospice. Choosing hospice means giving up all medical treatment. So hospice provides high-quality, whole-person symptom management treatments. So we're not curing the disease, but we are offering all those comfort meds, anything they need that is still offering them comfort, less pain, as long as they have kind of that low pain, that's really what we're going for. Hospice means giving up hope. So hospice recognizes there's still a lot of living to do and a lot to hope for. It's a huge part of volunteering, bringing in that joy, bringing in those social aspects. It's about that quality of time, not necessarily the quantity. So we really focus on encouraging families to do those life reviews, legacy work, things that still offer meaning and are still kind of offering something for after this person passes. Hospice is only elderly people. So the fact is hospice services are available to individuals of any age. Fortunately, individuals of any age can get that life-ending diagnosis. So we are actually having younger and younger patients. That's kind of the trend that's happening right now, which is sad, but that's just how the disease progresses. The myth is hospice is a place. The fact is most hospice care is provided wherever an individual calls home. So most of the time we're going out to the patient's home. I think the majority of our patients live in their own home or their child's home. So we're going into a personal home. The other half of those people are in long-term care facility, nursing homes, any of those kind of places. Hospice houses do exist, if you've heard of like a hospice house. I don't know if we have one in this area, but there are some in Pennsylvania. So those do exist. That's a very small percentage of the patients that we see. Most of them are in their own homes or in nursing homes. Myth, hospice is expensive. The fact is Medicare and Medicaid both have hospice benefits. Most insurance plans also have hospice benefits. With private insurance, you would basically pay whatever copay you already have. That would just be applied to hospice. Most people that we have are using Medicare or Medicaid to pay for hospice. And then hospice care ends when the patient dies. Like I mentioned, our bereavement support continues long after that patient has passed. For 13 months after the death of a loved one, we're still supporting them in person, on the phone, through mail, whatever works for that family. Oops, sorry. So a couple facts for you. Only 51.6% of eligible patients received hospice care prior to their passing. So that's about 49% of people that we're not able to help, that are not choosing this benefit. The average length of service for Medicare patients was 92.6 days, so about 3 months. 50% of patients were enrolled for 18 days or less, and 25% of patients were enrolled in hospice for 5 days or less. So we got a huge expanse of people, some just for a couple days, couple hours, and some for a lot longer. So before I move on to volunteering with hospice, any questions about anything I just talked about? No, it's a lot of information. Okay, great. So volunteering, this is what I do. So a couple stories about volunteering, kind of the benefit that it has for our patients. So a woman whose greatest joy was reading books, lost her sight due to complications, but is now enjoying books again because a volunteer is able to read to her. This is a story that is very common amongst our hospice patients. Someone that is hard of hearing or can't see anymore. We have certain devices that volunteers can speak into that are still kind of offering that sound to the patient. They're still able to read, quote unquote, the book that they're wanting to read through somebody else. A retired professor of North Asian Studies missed teaching. Volunteers took turns visiting him. He taught each of them the art of origami. He began to enjoy his life again, smiled more, and returned to writing poetry about his wife who died just the year before. This brought him comfort in his last days. So spending time with patients, doing whatever hobby they have. I had a woman who loved crocheting, and she was kind of struggling with, I think she had arthritis or something, that she was struggling to really do what she loved to do. So the alternative to that was her teaching a volunteer how to do it, instructing her verbally, showing her how to do it as she was able. It really brought her a lot of joy just to pass that along, pass on her joy to somebody else. So reasons to become a volunteer. You can make a real difference in your own life and the life of others. Studies have shown that volunteering is hugely beneficial for somebody's social life, as well as kind of feeling like you're making a difference, that emotional aspect of things. You're part of a community and a team dedicated to helping those facing life's most difficult circumstances. So I have a great group of volunteers that comes into the office, meets our whole team. You're really part of a community with us. And we also do ongoing education for you all. If you have questions on things like how to work with somebody with dementia, how to relate to somebody that you might not necessarily know too much about. And then we just had a presentation on bereavement. We had our bereavement coordinator come in and talk to them all about what exactly we do, how to get involved, things like that. You can enhance your own personal and professional growth. Like I said, I have a lot of high school students right now, high school and college students, and all of them want to be doctors. So that's why they're here with us, wanting to learn how to interact with patients, get that patient aspect of things before they decide that they want to pursue medical. And then you can choose your own schedule and participate in activities you enjoy and are passionate about. So I've talked about patient care volunteering. There's a whole bunch of other things you can do, which I'll talk about in the next slide. But we are very flexible. I try to make sure you're with a patient that's at least in your area, so you're not, traveling up to Pottstown and wherever else, and participate in activities. So I talked about patient care volunteering, those things like reading to patients, sitting with them, taking them outside, wheeling them around the facility. Administrative, we have a couple volunteers that come into the office and help us make packets for patients. They make phone calls if we need them to. They put together bereavement supplies, putting together those newsletters that we send out to all of our bereavement people. General support, any kind of community events that we have, things like those butterfly releases I talked about. You can come out, help interact with the families, hand things out, just kind of be a part of that celebration. And then professional volunteers. We have massage therapists, we have music therapists. I'm hoping to bring on some pet therapy volunteers. So I don't have any right now, but that's my future aspect. So people that kind of have a certification in something else and want to offer it outside of their profession, we can pretty much find a way to work you into our volunteering. Some other specialized programs, we honor veterans volunteers. So We Honor Vets is a program through the VA and the National Hospice and Palliative Care Organization. Basically, we offer all of our veteran patients that come onto service, we offer them a certificate of recognition, as well as a pin and a couple other things. So we have volunteers that are also veterans that go out and visit them. If they just want to do kind of a pinning ceremony and that's it, that is fine with us. Or they can ask to have that volunteer come back as a regular volunteer. We find they relate a little bit more veteran to veteran. And are able to kind of have some of those conversations that maybe they weren't able to have with their family even. Pet therapy, animal-assisted activity volunteers, like I said, that is my future goal. So the pet does have to be certified at an outside organization. There's a couple of Pet Therapy International, things like that. So they're certified as a therapy pet, and then your team, you and your pet would go out and visit patients, typically in a nursing home, and offer that. I think pets are great for people, especially people that are suffering from dementia and other things. Grace and Final Transition Vigil volunteers. So that is for somebody who is actively dying in those last 24 to 48 hours, and maybe doesn't have somebody with them. Their child is across the country and unable to get to them, or maybe they don't have family at all. This volunteer can go and sit with that patient overnight, wherever they're at, kind of in their transition, usually playing some kind of peaceful music, just kind of offering a presence for them so that they're not dying alone. And complementary and integrative health services volunteers, so those are those massage therapists, music therapy, pretty much any kind of interest that you have, I think we can find a way to make it work as a volunteer. I have one high schooler who was talking to me about, she was like, oh, I love music, I can play piano. I was like, well, I don't know how many places have pianos. She said, oh, I have a portable keyboard, can I bring that? I said, please bring that. So I'm actually going out with her tomorrow, hoping that will kind of prompt something in the patient that we're seeing. I think music is, again, another powerful tool for people that are suffering from dementia. But yeah, these are all the programs that we have for volunteers and more, always expanding. And any questions you have, and then this is the QR code to get to our volunteer application. If you're interested, you can also just look up Patient Care Hospice volunteering and email me. Any questions about the presentation? Like I said, there's a lot of information, all very beneficial and helpful, I hope. Mark, any
No questions? Wow.
Where is your office?
We're located in Wayne.
Wayne.
So we're right across from King of Prussia, actually.
Okay.
In the Eagle Yards Business Park.
Okay. And so if I get an application,
Mhm.
do you have a program to help, to get you into?
Absolutely. Yeah, so we have a process of an online orientation that kind of walks, it's a whole booklet of our volunteer rules and regulations. You work through the whole booklet, and then I have an in-person meeting as well. Make sure you don't have any questions. We go through some situational things, like what would you do if this were to happen?
Okay.
You're in this situation. And we talk about, documenting your visit. And so I try to make sure it's a good orientation and you feel ready before I just send you out. And I usually go with you on that first visit as well and introduce everybody, make sure you feel comfortable, know where you're going, and then we're always there for you for questions and all that kind of stuff. Any other questions? Yeah?
Not so much about a question about
Mhm.
volunteering, but for the hospice
Yeah.
possibly user, where does one find out about how to engage in the hospice?
Mhm.
How to start to make choices?
Yeah, absolutely. Yeah, so our larger company is called LHC Group. So if you look up LHC Group website, it'll have a lot of information about when it's time to choose hospice, what kind of services you're getting, like I've talked about. But also, if you have questions, great to talk to your doctor as well. They'll kind of know, hopefully, know about when is the right time and, yeah, knowing who to choose and things like that. There are quite a number of hospice organizations out there, so it's definitely some competition, so it's hard to know exactly who you're choosing. But hopefully physicians will help you with that. And yeah, we're a smaller group, but I think that we are able to kind of go out on more of a timely process than maybe some larger groups. So in my opinion, I think that we're one of the best, but yeah.
Does long-term care insurance cover hospice care?
That is a great question. I don't think so. I think long-term care would be more for your actual room and board at
Facility.
nursing home facility, exactly. But hospice care comes usually right out of that Medicare. So if you're within Medicare insurance, we're part of that benefit that you get.
It's a wonderful benefit.
Yeah.
I mean, my mom's been on hospice for a couple of months, and
Great.
I love the people that come in to see her, and they keep me.
Good people work for hospice, yeah.
Yeah, they keep me informed every step of the way, and
Yeah.
I'm only 5 minutes from her, so.
Oh, good.
They all know me.
Yeah. Yeah, we talk to families all the time on the
Yeah.
phone, whatever kind of questions you have, that's what we're there for.
That's really, really important.
Absolutely.
Jimmy Carter was on hospice for
He
a
was,
long
yes.
time. A long time.
That story, I think, actually prompted a lot of people to learn more about it.
Yeah,
which is
right,
super
right,
helpful.
probably they did, yeah. How many volunteers do you have?
I currently have 8.
Wow.
So like I said, I started 3 months ago and we had 0, so I'm working
Good.
my way.
Good.
Yeah.
And how many are in hospice?
We currently have 20 patients right now,
Okay.
hoping to grow that.
Mhm.
Art therapist, are there art therapists who volunteer?
That is a great question. I don't have any right now, but that would be great.
I mean, it's a whole, it's not just a hobby, it's a whole
Yeah.
separate, you can get a degree in art therapy.
Absolutely, yeah, I'm reaching out to kind of music programs at different universities. I might look into art as well. It's a great suggestion, thank you. Well, thank you all so
Okay.
much for being a great audience, I
Yeah.
appreciate it. And
Thank
it
you,
was great
Evelyn.
to kind of come out and talk to the community.
Thank you.
Thank you for
Appreciate
having
it.
me, Mark.
You're welcome.
Can you put the